Today on Meet Your Body, we have a very special guest, and we're going to be talking about kids and movement, the importance of movement diversity, and how to be an ally. Let's get started. Hi, I'm Jessica Vallant, a physical therapist and Pilates teacher, and I want to bring science-based knowledge, empathy, courage, support, love, and hopefully some fun to the journeys we have with our bodies. There is hope and strength in your body, and my goal is to help you find it. I am so excited for today's episode of Meet Your Body. When I first started to think about guests that I wanted to bring on this show, this person came top of mind. So I first discovered Dr. Jennifer Hutton on Instagram actually a couple years ago when I was in the physical therapy world doing a little bit of a dive, and I found her work as a pediatric physical therapist, and I really appreciated what she was teaching, what she was showing, and I knew there was a lot for me to learn personally in that area. And then she started to morph and do more teaching around the area of allyship. And I just knew that I needed to get her on here to share that knowledge with me, with all of you. It is such important work that she's doing. So we're going to get into her entire story, what she offers, the importance of kids and movement diversity, and then also some amazing tips and tools for how to be a good ally in the world today. You may want to really sit down, pen and paper to take some notes. This episode is rich with such amazing information. Here we go. Dr. Jennifer Hutton is a pediatric physical therapist from Nashville, Tennessee, and has worked as a PT for 14 years. She enjoys treating children with neurological and orthopedic diagnoses, both congenital and acquired. Working with children from marginalized communities allows Dr. Hutton to see the health and healthcare access disparities that exist, and sparked her desire to be an advocate for recreational opportunities outside of the clinic. Jennifer's desire is for children to find ways to use their imagination and find joy and fun in being active without the use of toys, tools, or technology. She recently released an activity deck called the Movin Activity Deck for kids that includes activities that allow kids of all different movement abilities to have fun while experiencing all different components of movement. In 2020, Jennifer founded Building Allyship, a membership community for healthcare and wellness professionals with a desire to learn what true allyship looks like. Dr. Hutton's mission for Building Allyship is to provide a platform for BIPOC professionals to share their expertise with willing hearts, facilitate a space of accountability, constructive challenging of ideas, community learning, and help others strengthen their voice and stance as advocates in their communities. I am so excited to have you guys here today and to introduce Dr. JPop to you. I told you guys a little bit about her in the intro, and I just have to say, because I haven't even told you, I found you online probably 2 years ago now, I want to say. But I hadn't found a lot of physical therapists online on social media doing awesome things, and I found your account, and I'm like, this is someone doing awesome stuff. Like, I was just like, follow. And it might have been after an idea fit. I feel like you had done a virtual. Okay, so that's when it was. It was after that virtual conference. And I have just been blown away. I love your pediatric work. I love all your work. So thank you so much for being here today. I knew I couldn't wait to have you on.
Thank you for having me. I'm excited to be on.
Of course. So I would love for you to tell everyone about yourself, your story, where you are now, who your people are, who you love to talk with. Tell us everything so everyone can get to know you a little better.
How far you want me to go back? Like 1983?
You decide. You decide. Birth, whatever. I want to hear it all.
Well, I'll make sure we get back into the path of PT. But I was born and raised in Nashville, Tennessee. Both of my parents were in healthcare when I was born. My dad still is. My mom has transitioned to real estate, but I'm one of two kids, and we grew up with an understanding that movement was important. It was probably one of the key principles that my parents were like, they're going to get this. So we had to play one sport, and that was a requirement. And if you, at teenager age, she was like, okay, if you don't play a sport, you at least have to do 30 minutes of something a day. And so it really kind of instilled that movement piece really, really
Yeah.
early, and I carried it with me up until the present. But I'm also one of 14 cousins.
Wow.
I know it's a big family. I love all my
Mm-hmm.
cousins. They're pretty
Mm-hmm.
awesome. But the youngest, I think I was 16 when he was born. He was born 3 months premature.
Okay.
And after a year or two, he was diagnosed with cerebral palsy. And so I remember being like, okay, wow, we don't have anybody in the family that has a
Yeah.
disability, so this is something that we're all going to pretty much learn together. So I was able to go to occupational therapy sessions with him and physical therapy sessions with him. And it's funny, the doctor told my aunt, he's never going to walk. Just put him in a wheelchair. And I always laugh and say he didn't know who he was talking to. She's going to move all the hell of and high water to make sure her kids get what they need. And so I also was able to see him go to intensive therapy
Okay.
and actually learn how to walk and use left strand crutches. And so watching his evolution, I was like, wow. So physical therapists are kind of like rebels in healthcare. Like the doctors get to say what you won't do.
So
And we get to
true.
say, oh, but watch us.
Wow. I've
And
never heard it put that way. I love
I've
that.
always been a rebel, and my mom laughed. She's like, "You always had a cause. We could never be mad at that. You always had something in you that you were fighting for or someone." And so when I started to see him traverse through society, and I remember vividly us going to Chuck E. Cheese, and he couldn't do anything without our assistance. And I was like, "Well, that's not cool. Like his friends are running around, and he wants to be able to be with them. This something like this needs to change." And so I
Right.
had this dream, like, oh, I want to open this facility where kids can come and play and da da da, and there'll be assistive rails. I hadn't thought about being a physical therapist at all. It was just thinking about him being able to be a kid in the
Mm-hmm.
world.
Yeah.
And I kept looking at PT, and I was like, you know what? This just makes sense. I want to be a
Mm-hmm.
pediatric physical therapist. So I went through undergrad, went through grad school, and it was funny. I have always been a great student, but I've been a horrible test taker in terms of those standardized type
Yeah.
tests. So when it got to boards, I failed the first round
Mm-hmm.
and was like, okay, what do we do next? Like, how does
Yeah.
this work? And I remember going back to my professors, and they were kind of confused because I was doing well in my
Mm-hmm.
classes and I did awesome on my clinicals. And so after a few months, they were like, we should probably get you tested and just make sure, we're
Yeah.
not missing something. And I ended up being diagnosed with ADD after I had finished
Wow.
everything. And I remember the psychologist was like, how did they miss this?
Yep. Yeah.
And so she went through kind of my habits and my behavior. She's like, you're just a hard worker. So you would sit for hours and study probably until you
Mm-hmm.
got it and understood. And if you didn't have that, then you probably would have diagnosed you as sooner.
Yeah.
So I was put on medication, started studying, and passed on the second round. Um, got back home to Nashville, Tennessee, because I went to grad school in Loma Linda University
Okay.
in
Yep.
Southern California, and didn't get the dream job that I wanted immediately.
Mm-hmm.
I had to go work in adult ortho
Yep.
for 2.5 years, but that kind of solidified a new love. I was
Yep.
like, ooh, ortho's fun. Like I kind of like
Mm-hmm.
this environment, but I still want to do peds. And so it's funny, I had applied for a job at the top children's hospital here in Tennessee. Didn't get it, but the director said just keep checking back. So
Mm-hmm.
every quarter, I would send an email and I'd say, I'm still available. I'm
Hey.
still ready. Just checking in. And 2.5 years later, he sent an email and said, hey, we have a PRN opening and we're looking for peds and ortho in in the department. It was like one of those moments when you're like, yo, everything just aligns. It
Yep.
really does. Like, it
Yep.
may not be in the timing that you want it, but it comes when it's supposed to.
Mm-hmm.
So I got my dream job. I launched into it, and I think that was 2011.
Okay.
And around 2016, I got the itch that they
Mm-hmm.
say a lot of therapists get where they're like, okay, is this it? And I think I just looked at um, the journey of a
Yep.
PT in healthcare, and I realized, okay, you either get to be a clinician or you travel up the ranks.
Mm-hmm.
I don't ever want to let go of treatment. And I definitely don't want a boss above me and then little bosses below me.
Yep.
So what else do I want to do? And so I really went on like an explorative journey. I took courses in different professions. I just literally listened to all the podcasts, all the books, started following all the people on Instagram just to see what are my options. Because I think in school, you can probably attest, like, we are told you're a clinician. You can either open a practice or you can go work for somebody.
That's it.
You're not really told, hey, this is literally the world is your oyster with this degree. And I think it's something I actually would love for us to change as therapists, is to say, I know people complain a lot about pay and all of this stuff, but man, this degree has power for us to do things in healthcare and in our communities as well. And so that's what I fell in love with. I was looking at, some of the marginalized identities of the kids I was seeing. I had a lot of chronic pain patients that were missing school, and I was trying to understand, like, okay, how do we work through this? And I had kids whose parents couldn't bring them to sessions. So how do we get transportation, or kids who were taking Ubers or buses? And it was really opening my eyes to, and even rural communities where, oh, I need you to come 2 to 3 times a week, but you live 2 hours away. And so when I started to see how broken the system was for those marginalized identities, I was like, yeah, this doesn't work. How do we make this work for everybody? And I started speaking out a lot more on it. I also started teaching for rock tape, which got me out there and actually learning more from different professions, which has been one of my favorite things, is to learn how other professions work and how we can work together. And then in 2020, when I left my job February 2020.
Wow.
Literally 1 month before we went into quarantine. And my plan was, I'm going to start a clinic, and I'm going to do it my way. And
had a great plan.
I was excited. I had stacked up all of these classes so that I could, I was ready. My ducks were in a row. And in March of 2020, within 3 days, all my ducks drowned. I was like, okay, so what do we do? What do we do now? So I floundered for probably like 2 to 3 weeks. I ended up seeing some of my old kids pro bono because the schedules were so limited for if you weren't an acute patient. And I had always wanted to do more online education. And I decided, well, I guess I won't wait. I'll flip and pivot and do that first while we're all at home. So in 2020, when I always say the world kind of woke up to a lot of the racial reckoning is what they're calling it. I was encountering a lot of people who were like, we want to learn, but we don't know where to start. And I was like, oh, I have all the books, all the articles, all the resources. This is something I've been studying. So I did a workshop called Anti-Racism and Allyship, and expected 50 people to show up. And 3,500 people showed up to that webinar and followed it. Like, not just showed up, but they followed, they stayed, they asked questions. It was clear to me, okay, people really do want to learn. They just need a space where they can do it, and it can be constructive, because it wasn't constructive on social media. It was just all over the place. So a month after that, I said, I'm not doing any more courses, but I am going to open up a membership. And that's when I opened up Building Allyship, and it was with the goal of creating a platform for BIPOC professionals or those that were of marginalized identities to share their knowledge and their expertise with those who were looking for transformation. And it has been amazing to watch, because it's something where I'm like, man, I can actually say I have an incubator where people are not just learning and really trying to transform themselves, it's transforming their lives. Like, I've had people in that community leave their jobs because it's no longer in alignment with the value system that they have. And it has been hope for me. It's funny because like I did it for everybody else, but it's really been a place of hope for me. And I've kind of taken that model and directed it towards peds as well. So I also have a course for pediatric therapists called Allyship and Advocacy, where we really for how many weeks? It was like 6 weeks. We fleshed out from history all the way to present disparities, childhood identity, racial identity, what it looks like when you've experienced discrimination, all of those things. And it's been fun for me because this is something that I've worked really hard to heal on when it comes to being a Black woman in America. And I want other people to have that space to be able to heal. And the only way we can do that is if there's more knowledge on both sides. So that's kind of led me to where I am. But also in 2020, a publishing company reached out. They were doom scrolling on Instagram apparently, and just happened to come across my page and decided, oh, we want her to do our exercise deck for kids. So literally to yesterday was February 14th. The deck released, and it's called the Get Movin
Yay!
Activity Deck for Kids, and I'm so excited about it. I'm just so excited. It's
It's
really,
awesome.
it shows a lot of movement diversity, not just in, of course, skin tone, hair
Yep.
texture, but also limb differences and
Yep.
assistive devices. And it's my way of saying, hey, kids can learn about this stuff even if they're not around children with disabilities. They can learn about it through different mediums. And that's my goal for this is, one, instill that principle that my parents instilled in me of how
Yep.
movement's important, but also kids being able to see other children move in the same way that they can, do some of the same activities, but also see some of the differences as well.
Yep.
So that's what's led me up until today.
It's amazing. It's so amazing. And I love what you said about values.
Mm,
So, one of your, and all of this, guys, will have it in the show notes, all the links and everything. But the Beyond Allyship podcast is such an amazing tool. And specifically, like one of my favorite episodes is the Allyship strategy. And it's so good. But you talk about that with values about if community, if diversity, if supporting marginalized groups isn't a value to you, then it won't come out in your actions. And I thought it was just such a good way to put it because so many of us can say, yes, that is that's what I want to do in my practice, in my family, whatever. I want to push this. But it's just like any other value you compared it to. You can say, oh, I want to exercise. Okay, well, you can say it, but if you don't actually create the time for it and actually create the space for it, you won't do it. It has to be a high level value. And so I don't know if you can talk to that a little bit about
yeah.
diving into, it's easy to say it's a value, but how can we actually place it on that top tier so that it
Mm-hmm.
becomes ingrained in our lives?
Right. The first thing I usually say is we got to explore why it wasn't.
Mm, so good.
And
That's really good.
that is really why more people fall off
Hmm.
than not. You have to ask yourself some really challenging questions where you probably will be very uncomfortable with your answers.
Mm-hmm.
And I always tell people I don't ever lead with shame. I can't stand shame. Shame gets in the way of the work. So it's great to start us off if you're like, oh, that doesn't feel good. But then we got to say, okay, what's the next step? So we in the community, we really work through, hey, what's your history?
Yeah.
What was your background? Where did you go to school? Can you think of maybe the differences that you saw in your communities? Did you go to church? Is everybody look like you? You start to ask yourself these questions, and you start to realize all of the things that shaped your identity. There's missing lived experiences.
Mm-hmm.
There's people that you didn't get to talk to. And I feel like if you look at it that way, there's less shame because it's like, oh, well, that means everybody is missing some lived experience.
Yeah.
Yes, we are. It's
Mm-hmm.
very hard to find a community where everything is accepted, and not only accepted, but included. So the first step is, okay, why wasn't it? And now that you want it to be, what are we going to put into place
Mm-hmm.
for it to become a value? It could be as simple as go find 5 people on social media that you would not normally follow,
Mm-hmm.
and something that you probably weren't exposed to, and then just observe and
Mm-hmm.
interact. Don't go in there and say, I want to learn. Literally just say, no, I want to expand my circle. I want to become more curious. And then after we do that, then I start to say, now that we've unpacked some of the past, now let's look at history, because it looks totally different once you've unpacked why these things were not a value to you. It looks different, and you're able to accept some of those harder truths too, and see yourself as part of a solution. One of the things you'll also hear people who say I'm an ally is they need to change, and they need to do, and they need to. And I always give them the example, if there is a Black person who's been arrested and they've committed a crime and they have to go to court and they make it to court, then I'm not saying I'm saying, how could we as a community rallied around our own to support them in this moment? I see myself, no matter what they're doing, I see myself in that person. So they're still part of my community. But when you're white and you're the majority, you fit everywhere. So technically, it's easier to become that individualist. Yes. Because you don't have to see, you're not like, oh, I'm not searching for someone who looks like me, right? Yep. So I always say we got to adopt the we first. So when you say anything, it needs to be we need to, because the goal of all of this is really just community. That's the goal of it, is for us to see each other as part of a community. And then it's, how do I align this with who I am? I never want anybody to erase who they are in this work, because who you are is special and you have gifts. So, for example, I had somebody in the community who was extremely introverted and loved to come to the sessions, but really was like, I'll probably never show up at a rally. Like, I can't go to a front. It's just not in me. And so we were like, I said, okay, well, I'm not going to force you to do the extroverted things. What do you like? And she said, I like hiking. Hiking is my thing. I like to go on trails. I like to do this. I'm actually writing a book. And I was like, oh, well, then let's use hiking. Where are there communities who might not have access to what you have? How can we change that? Can you join an affinity group? Maybe there's a group of Black people who go hiking. Can you just go and be a part of that community and see if you can just connect with different people? And honestly, that helps it become more of a value for you, because you're doing it in the context of something that's already special to you. Right. That's something that you're saying, oh, I love this and I want everybody to love it. So you're going to look for the ways that you can include the people who have not been included. Yeah. And that path leads to it being lasting, and it changes how you see all of the spaces that you're in, and makes you more curious with all of the people that you meet.
Yep. And it sounds like what you talked about on what currency do you have to use. Like, that was so powerful to me too. When you talked about, do you have time? Do you have money? Do you have a platform? Do you have a job? Like, so we have so much different currency. So I don't know if you want to touch on that or tell the Airbnb story, because I love that too. It just opened up. I'm like, oh, there's so many. I love that story.
I think we get stuck on, time and money. Those are the two things that we view as currency. But if you do have more a privileged background or living a privileged life, you probably have more resources than you realize. So the example I gave in that episode, there are 5 of us, 5 Black women. We all are entrepreneurs, own our own businesses, and we meet weekly to just talk about business stuff, to hold each other accountable, to say, what are you working on? How can I help? And we wanted to do kind of a retreat to plan for the next year. So my friend had an Airbnb in Silverthorne, Colorado, and I reached out literally to book it. That's all I did. I said, hey, can I get the link to book it? And she said, no, you can have it for as long as you want. If you want it for that week, it's yours. And not only did she give it to us, when we showed up, there were notebooks, there were whiteboard, there was stuff there for us to be able to do it. And there were snacks, because she recognized, I can't remember what percentage. I want to say it was like close to 90% of Black women's businesses fail within the first 2 years. And all of us were in our first 1 to 2 years. And that simple knowledge, knowledge let her say, oh, well, I have a resource, because if they need a space to plan, I have this, I want to, and she just gave it to us. And I said, that's a resource, and that's allyship. Being able to say, I have something that I can give to make sure that you can do what you need to do to thrive, that's currency. And I think those are things that we need to realize. No, you may not have $5 to give the person who's homeless on the street, but do you have a bottle of water? Can you go get them some food? Can you, these are the things that, or can you say, hey, where will you be tomorrow? I want to make sure that I can bring you things. It changes how you view the people in that surround you, and it changes how you view what you have. So that you say, I do have currency. Maybe maybe yours is time and you can babysit someone while they go off to do a course or do something like that. But looking at all that you have at your disposal to say how you can give to other parts of the community.
Yeah. Well, and I know you do say privilege is power, and that's absolutely true. I mean, so many people I know want to skirt away from that, but it is true. We have a louder voice and we have things that we can use, and we have to sometimes be creative in how you think of it. But absolutely, there is a power there. And learning how to make it a value and how to harness it, I think, is really important. And taking the steps and the knowledge from you and people teaching, not assuming. That's something I know for me, to touch on, like, I almost assumed, because of my privilege, that I knew how to do this, right? I know how to use my voice correctly. I know how to offer up my platform. But that too was just privilege speaking. I had to really, like you say, step back and say, oh, I just need to listen here. Like, there is so much learning I have to do before I know how to talk to my kids, before I know how to even pass this on to them. I need to myself.
Yes.
Yeah. I'm just so thankful to have you.
The privilege is the power one. That's one that people tend to shy away from. They feel ashamed of their privilege. And I'm sitting here like, no, let's not waste it. How can we use that? How can we use that power? And it's funny, once you start to exercise it, you start to realize, man, if we all could do this together, we could make some extreme changes in our communities, in our jobs, in our society as a whole. So that's my message that I preach loud and wide. Your privilege is your power. Let's figure out how to use it.
Yep. Yeah, absolutely. And I don't know if you can touch on also, this is just something I think on a lot, is I think online just makes it really interesting. And so when I was working with my own DEIB coach, and we were talking and doing the work, and I have an online business, and we went through everything, and like, okay, on our last session, here we go. And she said, and also, remember, what you do online is great, but it's what you do at home and in your community that is going to be more important. Like, you work online, that's great. Like, say what your value is, state it, do the work. But what does it look like at home? What does your kids' school look like? Who do they see in their neighborhood? And how can you move forward with that? And it's just something I've never forgotten, because it is different. It's different. Sometimes it can feel easy online to put up a post, and then you get home and say, oh, how do I do this differently? So I don't know if you can touch on that a little bit, and if it looks different to you, if it's the same kind of idea, or how that plays out.
No, that is. I think social media in general can be performative. It's not just for DEI related stuff. It's for everything, because it's a snapshot of your life. And I think it's important for you. I know we all want to be seen as a good person. And I think that's why it's easier to say, I'm going to do this. I'm going to post about this. I'm going to share this. And please do, because your followers may absolutely need some of that information. But yes, the more important work is in the day-to-day, because the day-to-day is where those of us with marginalized identities are experiencing the trauma. We're experiencing the microaggression. We're experiencing daily. We're being caught off guard at the grocery store, or, at the park. So we would much rather you show up for us in day-to-day life than on social media, because I can't do anything with that post. You are probably helping someone else and how they operate in their community. But that big piece is, what do you come back and do in the other 24 hours of the day? Because 23 hours and 59 minutes, because there's 1 minute to post. So no, I absolutely believe that. Absolutely. And I think it was a point of contention probably in 2020, because everybody was posting and sharing.
Yeah.
And if you don't post this, then this, that, and the other. And if we don't see the black square, and it's like, yeah, honestly, that black square can't do nothing for me right now.
Right. Yeah. Yeah. And then I guess farther into that too, you talk about community
Mm-hmm.
and auditing your access to accountability in the
Mm-hmm.
groups that you're in. And that
Mm-hmm.
was another powerful one for me. So I don't know if you can touch on that
Yeah.
because I know a lot of our listeners don't necessarily have a social media presence or platform. You know, they
Mm-hmm.
are at home. They're moms and they're at home, or they're grandmas and they're workers. And so what does that look like? Like, what does that mean in your community to audit the accountability or
Mm-hmm.
access to it?
When I say that, I'm definitely considering why I created Building Allyship. Um, I wanted there to be a place where there could be constructive challenging of ideas, but there, I can tell you probably every Black woman in America has a group chat. And in that group chat is where we go and we say, this is what happened to me today. These are the stories. This is what so and so said. I'm so tired. These are the things that happen in the group chat. And I recognize while two things can be true at once, they don't always need to be in the same space because we're all operating on different timelines. So if you are just new to allyship and you are wanting to be an advocate, that probably won't fly in the places where people are saying, no, I'm experiencing microaggressions. I don't have it to educate. So we find those spaces where we can be educated, where we can find voices that will keep us in check of marginalized identities. But then we also need to find people that are on the same journey, because by doing that, then you all can be in tandem with each other and say, hey, what have you been reading? What action step are you taking this quarter? How can I partner with you? Is there a group that we can partner with together? Widening that circle and creating your own base of support with this can make it so much more effective. And that was really why I created it, because I was like, y'all need a group chat.
Yeah.
Y'all need a place to learn, but you also need a group chat, because a lot of these conversations were happening online,
Yeah.
and it was causing more friction because there were Black creators who were saying, I'm not an educator on this. But then there were white people who were saying, oh, well, I'm not coming to you anymore because you got an attitude when I ask you a question. It's like, well, we all have to understand that there are different times and spaces for different things, and they all can't happen together. It would be beautiful if they could, but I can't heal in the same place that you learn.
Yeah.
And we need to respect that those need to happen in different spaces.
Yep. Well, and you mentioned that that's almost the most important piece, and that research shows that it's just about the most important piece. And I think for anyone listening, if you're like can't quite get your head around it, I mean, it would make sense if we say it about exercise, right? Everyone knows is, oh, you have an accountability partner. If you're going to meet someone for a workout, you're more likely to go because you don't want them to, feel bad. You don't want them to miss out. You don't want to feel bad. So when we think about it that way, it makes sense. And to bring it to this, just oh yeah, I mean that makes sense to have people in the space who yes have the same value that I do, that would then keep me accountable on that value.
Exactly. I think it was a Forbes article that said you're 95% more likely to follow through on whatever you've set as a goal or a task if you are meeting with a person, another human individual. So I think that when I saw that, I was like, yeah, this is why.
Yep.
Because I think we try to put allyship in a box that's separate. We make it a lot harder than it actually has to be. It's similar to any other value that you're trying to accomplish. It's just it includes people. And anytime you include people, things can get a little sketchy, right? Because you got to realize, oh, I'm going to make mistakes. I'm going to say the wrong thing. Somebody's going to bring it to my attention. I'm probably not going to I don't want to be seen as a racist. I want to be seen as a good person. These are all of the things running through your head. And so it's just really important for you to say, yep, this is what we're going to have to do in this space. It might be harder because there are people included. But if I have somebody that I can run to after something happens and say, here's what happened, can I impact this? Yeah. Then you're more likely to get up and say, okay, we're going to do this all over again because it's that important to me.
Yeah. Which goes back to exercise too. I mean, especially as PTs, what do we always tell people? You never have a move right the first time you do it. Like you have to do it 50 to 100 times before your body even accepts it as a habit and a correct movement pattern. And this is a new movement pattern for a lot of us, especially us
Hmm.
who grew up privileged. It's a new movement pattern, but if we don't try to learn, then we're not going to
Exactly.
learn.
Exactly.
And I almost feel like your movement deck. So for those of you who don't know, actually, so the movement deck, it's this amazing set of cards. Oh, here it is. It's an amazing set of cards for kids, and you pull it out and it's beautiful illustrations and it's all different moves, but it tells them visually how to do these moves, like a snake or like a tree in the wind. So it just gets them moving. I mean, honestly, on a snowstorm day like for us today, it's perfect. I'm always doing stuff like this. But like you had mentioned this, that there are a lot of movement decks out there. This isn't a new concept.
Mm.
But what's new is the images that the kids see. Different hair color, different skin color, different texture, but also different abilities. Like so many kids will never see a child in a wheelchair. I mean, my kid still, my 5-year-old, when someone on crutches, oh, did he, we saw someone with a prosthesis recently and he had so many
Hmm.
questions. I'm like, great, let's talk about this. This is important. And somehow that feels, depending on our comfort zone, that can feel easy to talk about or not.
Hmm.
Same with race, it can feel easy or not. But
Right.
I feel like a deck like this could be just such a great way. If you have a choice between many different decks, you choose this one. You choose one
Yeah.
that's going to show your kids images that will open up questions and just let them know this is normal. This is life.
Hmm.
This is the
Yes.
world we live in.
I used a lot of the kids that I treated as inspiration for the illustration.
Wow.
Um, and because on the therapist side, you have the conversations with the kids when people are starting to ask more questions and school gets a little different and their mannerisms and demeanor changes because they're starting to realize, man, this is a difference that's going to carry me through life. Are people always going to ask me questions? Is it always going to be somebody staring at me? And I've seen that side, and I think that's why it was so important to me because I know how those kids, I know how those kids feel. So it was important to have a kid who maybe has an amputated arm or a prosthesis or, or a gait trainer so that kids can say, what is that?
Yeah.
And if you can say it on the card, it can be a lot easier for parents to explain it when they're not in the space. And
Right.
I just wanted to provide something that's like a teaching tool as well as something that gets their bodies moving and their imaginations flowing
Yeah.
outside of something on a screen. That was really
Yes.
important for me.
Oh, absolutely. And I think too, for those listening, you and I have, being in healthcare, we do see it. And so some of you might not, but this is absolutely true. We see and have seen clients and patients like this, and people who can't pay, and people who are in rural communities and can't be seen. I saw someone just today by Zoom who, for 7 years, she's had pain and finally had the money to
Mm.
see someone virtually and has never followed up with a doctor. I mean, this happens daily. And if you're not in the middle of it and you're lucky enough to have kids and family members who are healthy and able, you don't necessarily have to see it. So just to know that that alone also is a privilege, and to expose your kids to this now, even if they're healthy and not a part of it, it's going to help them later on. It's going to
Mhm.
help other kids in their communities and in their circles. It's going to help you. It is so important just for empathy and compassion to
Yes.
see people who don't look like you.
Yeah. And then see them doing things that the kid does do.
Yes.
I think I have one kid who is in a wheelchair, but we're doing blowing bubbles. Like we're working on breathing. For a kid to be like, oh my goodness, he can blow bubbles. It also allows you to see some of the similarities. Like, yes, they are, but they still can do
Yeah.
some of the same things that you do. And
Mm-hmm.
seeing those similarities makes you more comfortable with your curiosity about the other
Mm-hmm.
parts of them that you might not understand.
Yep. Yep.
Yeah.
Yeah. And like you said, it's not a screen. And I will say, as a mom, after the last 2 years, anything that's not on a screen for my kids, I will celebrate because it makes a big difference. And it really
Yeah.
is you, especially if your child can't read. My 5-year-old can't. So I would read the
Hmm.
cards with him. And that's important too. I mean, research shows just doing these things with your child, letting them ask questions, it can be a part of so many things, but I love that it almost goes back to what you said. It can be the currency that you have.
Yeah.
Like you're a mom with a
Absolutely.
young kid and you feel like you're stuck at home and you have nothing to give. You have this to give. You can show them diverse images and movement, and you can have conversations with them like that. And that in this season of life might be the currency you have. And that's okay.
That's good. Yeah. I think that's the other bit. It's not, I'm not going to say, and that's just fine. No, that's good. Whatever you have and you're using, that's good. And I definitely, in the opening booklet, put several ways that you can use it, because I'm like, I don't want to just give something and say, okay, use it. Like so I put all of the different ways that you can use the card in group settings and individual settings, as a family. So I'm extremely excited. I saw it says no judgment. The screen is, I understand. I have a nephew. I get the screen.
Yeah.
But just in case you want something else, this will be an alternative.
We do. I promise. We want something else, please. Thank you so much. And to wrap up, and I know I'm putting you on the spot. I didn't tell you I was going to ask, but just if there's anything people leaving today, like one action item, if they say, okay, I do want to make allyship a value, I don't even know where to start. Like, is there one action item that they could take to start today?
I'm going to gift your community my ebook.
That is amazing. Oh my gosh. You guys, this ebook is awesome. I've seen it.
Yeah, that's what we'll do. That's a great start. I think that's amazing. A great start. Is just being able to see. I think I wrote this ebook at the end of last year, and it was based off the habits of what I saw over the last 3 years in the community. And it's called The 7 Habits of Highly Effective Allyship. There are action steps in there, the phases of allyship. There's terms and definitions and concepts in there. So that will be my gift to get everyone started.
That's amazing. You guys, that's huge. I'll put the link below. I'll put the details below on how to get it. And then tell us all how to find you, how to find the deck and order it, how to get into your community. Tell us everything.
Yeah, so if you want to follow me, I am most active on Instagram. I am most active on Instagram, and that's Dr. I'm also on Twitter and Facebook as Dr. JPop, but I don't really live in those spaces. If you are interested in joining the membership, they're on my website, which is buildingallyship.com. You can fill out the form, and I'll put you on the wait list. So I think I'll be opening up the doors at the end of March. Awesome. That's the goal. There's always the podcast, which I realized I forgot to say anything about, which was Beyond Allyship with Dr. JPop. Free resource, and my goal with that was to take some of the stuff from Building Allyship and share it as well. So those are all of the spaces that you can find me.
Awesome. What about the deck? How do we find the deck? Yeah.
You can order the Get Movin Activity Deck for kids on Amazon.com and on barnesandnoble.com. Those are probably the easiest 2 places that you can order it.
Great. And I'll have the links for those below too. Yay. Thank you. Really, this is such a gift. I could talk to you all day. Thank you so much for being here and just offering all of that to all of us. I appreciate it.
Thank you for having me on.
Of course. We'll talk to you soon.
Okay.
Bye. I hope you all got as much out of that conversation as I did. And honestly, I feel like it's just the tip of the iceberg. I really did want to keep talking for hours. And luckily, Dr. JPop has some great resources. I highly recommend her podcast that we mentioned. Has some really great information there. And then we have the Get Movin Activity Deck here in our house, and we love it. Both kiddos love it. I love to sit and do it with the kids. We pull out the cards. They're colorful. They're fun. We laugh. And so I'll have the links for all of that below in the episode description. And follow Dr. JPop. Continue to learn. Continue to realize the importance of movement for all people and what we can do to be an ally. Thanks for being here, and I'll talk to you soon. As always, thank you so much for stopping by today. If you have a moment, please rate and review this podcast, as it helps us tremendously. You can find all of our resources and information below in the podcast description.